Hi, my name's Frank Quinlan and I'm the CEO of Mental Health Australia. And I've come to the Parliament today because this is where, as the people of Australia, we bring our claims at election time. And for our 2016 election campaign, we're asking all the major parties, all the minor parties, in fact all the candidates for the election, to commit to a long-term reform process for mental health. We know that over the years, mental health reform has proved difficult. And I think that just underscores the need for all of the major parties to cooperate across the floor to ensure that we can have some long-term objectives to pursue. Today, we've also written to the leaders of the major parties and asked them to commit to key objectives for mental health reform. Firstly, we've asked them to commit to 3 key targets and indicators. How can we know that our mental health system is working effectively or not if we haven't defined what success is? So we're suggesting that we need to define success as being a reduction in the suicide rate, closing the gap between people who experience mental health conditions and other physical health conditions, and reducing the death rates and early deaths, and also ensuring that people who experience mental illness and their carers are able to enter employment and education and training and other forms of participation. So we think those 3 key indicators would allow us a much better basis for measuring long-term reform. But we're also asking for a couple of major themes to be adopted. The first is the most important. We're asking that consumers and carers be placed at the centre of our reform processes, and that consumers and carers be engaged in the co-design process that will be required to ensure that the mental health services and programs of the future are actually meeting people's needs. Then finally, we're asking for the envelope of mental health spending to be protected. We know that times are difficult, and we know that it's very difficult to achieve new financial investments in that environment currently. But we certainly think that for the short term and foreseeable future, we need to ensure that any monies that are saved in one area of mental health are reinvested in other areas of mental health. Because we know the need is great, we know the need is greater than can currently be met by the existing services and programs. And we know that reform will only achieve certain efficiencies. It's very important that we ensure that those efficiencies and those savings are reinvested in mental health. So they're our core claims, and today we're not just making a request of the leaders of the parties. We're making a request for all of you to get behind this campaign. We want you to talk to your local members, we want you to talk to candidates in your electorate, we want you to talk to your family and friends, and we want you to ensure that mental health and mental health reform comes to the centre of the political debate so that we can have a long-term prospect of achieving the reform that we all hope for. Thanks for your time.